Rare Cancers Australia celebrated 10 years of advocacy last year. That's a significant milestone to celebrate all the people you have touched with your work. On a system level, however, what changes, if any, have you witnessed in the healthcare landscape over that decade?
Yeah, look, I think there's a much greater awareness of rare cancers. I once said that in 2012, no one talked about rare cancers, and in 2023, you never have a conversation around cancer that doesn't include rare. We haven't solved all the problems, but what's happening with the evolution of genomic science is that all cancers are getting rarer and rarer, and every cancer patient is a different cancer type. And the only way forward for this is to have a comprehensive national plan around genomics and genomic testing. And that's not just clinical. We can't continue to treat people with therapies that if we did genomic testing, we would know would be ineffective. It's immoral not to test and just to let them be treated and take precious time away from both alternative and more effective treatments, but sometimes just time away from their family with false hope. There's a whole ethical issue around this that we need to be open and frank and discussing about it. And the last side of it is the economic benefit that goes with this, that better testing means better treatments, and if we learnt nothing from COVID, only if you have a healthy population can you have a healthy economy. And that's what we learnt in the last 3 years. That's what COVID taught us, and that's what we should be focusing on.
What does the ideal future look like for you in this space?
I would love a situation where the first thing that happens to someone diagnosed with cancer is that we actually run the tests and actually understand it and sit down and say, hey, this is what's causing your cancer. These are some of the risks that we can address. These are the treatments that address it. Let's get on with it. Let's monitor it, and let's not sit here and work without the full. Let's not work in the dark. Let's get this right. And I would just encourage all those who are watching to be loud and proud about it, because it's so critical that not only is this science implemented, but that it's implemented here in Australia.